One of the things I see that a challenge what a lot of new doctors face is about the differences in the practice in Pakistan, India, or in the subcontinent, or in other countries, Nigeria, Egypt as well. And when they, particularly in reference to psychiatry, if I'm not wrong, it is predominantly medication driven and it is predominantly therapy driven here in the NHS or in the UK. What's your version of it? Is it true, or and do they have to make any sea changes in the way they look at things?
So, if you want me to take this one first, I think um, mental health is a field which is rapidly evolving. We don't know half the amount of stuff about the brain as we do about the heart and the liver. So we need to come from that place of humility where the brain is a part of our body whose understanding is rapidly and constantly evolving, and hence we're just trying to figure things out. Um, it's important to come from that place of humility and awareness. The good thing about psychiatry is that there's a very small bunch of medications. As far as if we're looking at the thing that we need to memorize during our student phase, someone who's done psychiatry in India, Pakistan, Nigeria, the US, New Zealand, Australia, although very different training programs, they would still be able to at least survive in a different country for their basic 9 to 5 job, because we still use the same medications every corner of the world. And an analogy to that I think might be interesting is internal medicine is vastly different in a country like India and Pakistan than it is in the UK. Because internal medicine in India and Pakistan is a lot about communicable diseases, whereas in the UK is much more about non-communicable diseases. Whereas schizophrenia treatment is still the medications you prescribe for schizophrenia in India and Pakistan, very similar to the medications you prescribed in the UK. So you don't need to learn more things from a pharmacokinetics or pharmacodynamic perspective. The things that you probably need to learn and understand more is the Mental Health Act side of things, the way the law works, which again in India, I'm aware that the new Mental Health Care Act is very similar to the Mental Health Act in the UK. So these are things which, yes, there are differences, but the differences, to be optimistic, are in the systems, not in the core basic, uh, you know, base of your subject. So if the base of your subject is clear in psychiatry, if you know your no, if you know your fish psychopathology well, if you know your basics well, if you know your delusions, hallucinations well, you know your benzodiazepines well, your antidepressants, antipsychotics well, then you're going to live here. It's not going to be very difficult.
Yeah, I mean, I would say I second that, but I was just saying, practically speaking, when people first come, it is an expected thing that initial few months you will struggle to not struggle, but you may find it a little bit overwhelming, that to try and understand the system. So, and by understanding the system, there are a lot of things which you may have not seen. The way services are set up, like what is the community mental health team, what is the crisis team, what is the assertive outreach team. So these are the community team which you would get to know what they're doing. The role of a community psychiatric nurse, how highly trained our nurses are in UK, the role of occupational therapists, the role of psychotherapists, and how do they fit in the team, and what is your role within that. Then there's like aspect of an inpatient service as well, that what actually happened in inpatient. Sometimes we have separate. Quite a lot of time in UK, we have separate inpatient and outpatient teams. The inpatient is only looking after inpatient. The community team is looking after the community team. Then the subspecialties within the psychiatry. So it's not that you haven't experienced that. You wouldn't struggle to see the patients. You will find the symptoms. You will be able to recognize the symptoms without any problem. But this is just understanding the system, how things are happening, where are the patients coming from, what is the role of primary care in all of this, how much a GP can treat, when the patient will come to you, what is your responsibility, how do you follow them up, risk assessments, all of those things. And the Mental Health Act, obviously we have the same thing. The Mental Health Act, I've seen the Mental Health Act in Pakistan, which is kind of almost like similar to the UK Mental Health Act, but they never actually practically apply. Here, those act would be practically applicable. So if you're working, especially in the inpatient service, what are the restrictions that the act has got, and all that. So these things are not difficult to learn. This is something, because you haven't experienced in the past. This will be something new for you to learn. But then slowly and gradually you will start to learn that. And as you know, we've already said that the medications are actually the same. This group of medications especially are the same. just about the protocols of how when you start them, how do you do that, what is the monitoring requirements and follow-up requirements and all of those things. These are things you can pick up very quickly. And I've seen and I've sort of mentored got a lot of Indian, Pakistani, Nigerian, Egyptian doctors, and I believe they are very good. If they have done the MD or FCPS back home, they're actually very, very good doctors. When they come here, they don't actually, within a few months, they are actually up to speed, and they understand system very well. So it's not that this is a massive struggle. I would say.